This video will show you how to access the scheduler. Now there is a schedule by patient and also the scheduler by caregiver. The icons for these schedulers can be found in your toolbar and can also be accessed by clicking on File, selecting Scheduler, and choosing whether or not you would like to view the scheduler by patient or by caregiver. The scheduler by patient can also be accessed after completing a status record, OASIS, and entering in 485 for the patient. Once you highlight the status record, you can click on Edit and select Scheduler. This will bring up the scheduler by patient, and it automatically selects that patient along with the certification period that was highlighted. On the bottom portion of the scheduler by patient, you can view the visit frequency if entered in the 485. We will go over this in a future lesson. You can also view the orders as well as the goals. The scheduler is also color-coded based on the discipline performing the visit. There is also a summary at the end of each week that shows you whether or not you're in compliance with the visits that have been scheduled. To schedule a visit, you would simply highlight the day, and on the right side you would select the discipline. You have your supervisory, skilled nursing, physical therapy, speech therapy, occupational therapy, social worker, home health aide, and also any non-skilled visits. You can schedule visits one by clicking on each day and selecting the discipline. This will bring up the appointment window. You can then set the time in and time out, select the caregiver performing the visit, selecting the type of visit, and also if there are any sub-accounts such as medical supplies or mileage accounts that you would like to add to this visit, you can enable sub-accounts and select the item from the list. If there are any remarks in regards to this visit, you can type them in here. If not, click Save. You now see a 0 over a 1. What this implies is that there is one visit scheduled for that day, and based off of the color code, it's a skilled nursing visit. And the 0 on top indicates that this visit has not yet been posted to the patient's ledger, or it hasn't been done yet. To post multiple visits for each type of discipline at one time, you can click on a column header or a row header, and it'll highlight the entire column or row for you. To deselect it, simply click on the column or header again. If I would like all my skilled nursing visits to be performed on a Friday, I can highlight Friday, click on SN, and create my appointments again. The scheduler by patient also has 3 different views. We are now viewing the calendar view. There is also the detail view and the summary view, which shows you the different types of disciplines, how many visits were scheduled, posted, and also missed. While creating your appointments, the program may give you a warning if you are overlapping any visits with any caregivers or any patients. For example, if I try to schedule a home health aide visit the same time and date as my skilled nursing visit, the program will let me know that the scheduled visit overlaps with another visit for the same patient. And the new appointment that will create the overlap is the visit that I am currently trying to schedule. You can ignore the warning since it's a pre-appointment, and once you receive the visit note, you can change the time and date of the actual visit.